Hi, I'm Dr. Bill Huntzinger, and I'd like to sit and talk to you today a little bit about MyShield and how that product works, because what we really want to do is we want MyShield to be your shield. So in my operatory right now, if you look around, we have all the hand care products in here. I have hand soap and I have hand sanitizer, which those two products are great on your hands, keeping them clean and also coating them with a nanopolymer and using Zetrisil technology to protect your hands and protect patients. Now, what do we also have in here is and you can't see it, which is great about it, is that we use a product called MyShield Broad Spectrum. And broad spectrum is used in any place in this office. And some of it's in the operatory, a lot of it's out the reception area, it's all over the place. But what happens is when you clean with this product with Zetrisil technology, you're cleaning it and sanitizing it, and what happens is that it leaves a nanopolymer coating on every surface. Now, we've got a study from the University of Michigan, which you got to understand, I'm an Ohio State person, so it took me a little while to understand this because I live in Toledo, which is near Ann Arbor. But we talked to a PhD there who's done a lot of these studies, Dr. Z, and what he's done is we've got a study that he states in the study where they did it in the University of Michigan locker room with the lacrosse players, where they used a brand X product, which ends in Veer, and our product. And the study states that our product, whether used once a day or twice a day or every other day or 3 days, is more effective and lasts longer than any other product I've ever used. And he highly recommends it to be used anywhere and everywhere in an office like ours. Now, we have another product which we also use in the office called hospital grade MyShield, hospital grade. And what that will do is it has all the ingredients in it so that it will kill bacteria and COVID and everything in your office on the other surfaces. So if you've ever seen a video of an office where it shows spray coming off of a patient's mouth and it goes everywhere. Like since COVID, I wear a shield now all the time and think about it. But what it'll do is any of these surfaces where blood can hit or anything else, it'll clean those and also protect them. Now, we always clean everything between patients. But as a professional, you know that occasionally spots get missed in the office, like some of these corners. And what you find is if you use our product, MyShield, on any of these surfaces, you have long-term protection. You can rest assured that those surfaces are protected for hours or even days. Like I say, we have a lot of great studies on this. Actually, University of Michigan did it, believe it or not. So what I'm going to suggest to you is that you look at our product line to be used in your office. Now, some of these other products, and I think I have the back of one over here, you might be able to just barely see it, is probably the biggest one in the market right now. And this particular product, if you look at it, it's got some interesting warnings on it. But one of the things we find that it has done is that you have to be careful with it because it'll damage your equipment. So I have a really nice ultra leather chair here. We put plastic on everything, but with that product, you really can't use it because it'll wreck this stuff. I have a repair person that I use, and he's been in the business probably 30 years. We actually, if you look at our hoses and stuff that we use it on, they crack, they're destroyed, it corrodes anything and everything in the office. But this hospital grade product will not do that. And it will kill everything that this product that you can barely make out over my shoulder does. So I'm going to suggest that what you want to do is you really want to sit down and look at our product line, go to our website, Germ Free Innovations, and take a look on how we can protect your office, how we can protect your patients, how we can protect your staff. So again, I really would suggest that you look at that. Now I'm going to pause for a minute, and I'm going to go into another topic, okay? So now I'd like to also talk to you about something we've done with our staff. You can see my beautiful scrubs today. It says Dr. H because Huntzinger's too long. So what we have and what we've decided to do, and we did this during COVID, is that MyShield has a product which is an additive that you can add to your laundry detergent. And it's like a softener product. So what it does is that you wash your clothes, you have this in the fabric softener side, and it'll give you the final rinse and put the softener in your clothes. And what it does is it also has Zetrisil technology. It also has a nanopolymer. So what happens is is that your scrubs are coated with this material. And the way it works is that once it's dried and it's on your scrubs, any bacteria that land on your scrubs are also killed, okay? So what you can do is you can feel very protected with your scrubs on your body. So let's just say I did touch my scrub. Well, again, dry kill, that bacteria is killed on the scrub. So we use that product with every load of laundry we do with our scrubs. And again, it protects staff, it protects patients. Great product. There's a detergent product that's out now too that you can use with it. Together, they're unbelievable. So it's a great system. So also what I want to talk to you about is how the broad spectrum and the hospital grade product, you put them on the surface, you clean it, and we have wipes also. But what'll happen is that you'll clean it, and normally when you're using the product over my shoulder, you'll find that it's only working while the surface is wet, okay? Our product with nanopolymer and Zetrisil technology kills when this is dry. So what happens again, and we have a really nice video that explains how this works online, but bacteria will hit this surface and they'll be killed because there's the nanopolymer on here. So there is not a product on the market right now that I know of that has a dry kill system. And again, we have a lot of great studies, but the one out of University of Michigan really kind of gives a lot of credence to how this works. I mean, you can imagine a locker room with the lacrosse team at U of M, how nasty it can be. So again, they found that this provided an unsurpassed level of protection for their athletes and the people that are in the locker room.